Now the next chapter we want to do is 13, which is vascular pathology. Now, one of the first important diseases we want to talk about are the so-called vasculitides. Now, with these diseases, it's important that we think that the inflammation is secondary to some type of immune response. So that's the origin of the disease process. But the point is, you're going to always get a vasculitis. Now, what's also going to be important are the size of the blood vessels and which blood vessels are involved to give you the manifestation. So again, we're going to do what? Compare and contrast the different diseases, how they present, and which type of blood vessels are involved, and, very important, the type of inflammation that you will see, because they will ask you that on the step. The first disease we're going to talk about is called polyarteritis nodosa, or PAN for short. Very important, typically seen in young males. Okay. Now, very important that this disease can affect every organ except the lung. Don't forget that. Every organ except the lung. Very important that typically they're going to be small, medium-sized vessels. And these patients are going to have, you see here, hematuria, abdominal pain, renal failure are the classical things that we'll present with. Now, very important, you get this so-called segmental necrotizing vasculitis. So necrotizing, I always think what? Neutrophils and acute inflammatory cells. So you're going to see all these neutrophils coming in, and they're going to be damaging the wall and the surrounding tissue. So in effect, it's going to kind of look like what? A type 3 hypersensitivity, where you also get the vasculitis and the neutrophils coming in to attack the complexes and getting thrombosis, etc. Okay? Now, so just like with type 3 hypersensitivity, you're going to get fibrinoid necrosis. That's very important. Also notice you're going to get thrombosis, like I mentioned before, and of course, infarction. Now, very important that about 30% of these patients are going to have positive hepatitis B surface antigen, so there may be a history of what? IV drug abuse. So again, your classical patient is going to be a male IV drug abuser. Again, positive hepatitis B surface antigen. The other thing that they will actually look at is this so-called ANCA, which stands for anti-neutrophilic cytoplasmic antibody. Okay, so the point is you got antibodies inside the cytoplasm of neutrophils. Now, you see here, it can either be P-ANCA or C-ANCA. P-ANCA just means that the antibodies are perinuclear in the cytoplasm. However, typically, P-ANCA is associated with your microscopic pan. Okay, so P-ANCA we typically associate with microscopic pan, which means smaller blood vessels like capillaries, and be aware that microscopic pan can be seen in the lung. Okay, so true pan is not, but microscopic pan associated with P-ANCA can be seen in the lungs. Now, very important, because it's associated with an immune response, that you can give what? Steroids or cyclophosphamide to treat the patient. Okay, very important. Again, because it's association with the immune response, you can give steroids or cyclophosphamide to treat the patient. Okay. Now, this Churg-Strauss syndrome, the key thing with this one is that you see here is a variant of PAN, and I would note its association with asthma. Okay, I would note its association with asthma. It's very important, and the fact that P-ANCA may be present. So that's the main thing for that. And again, because it's association with asthma, you can see what? Eosinophils. Okay, so be aware of that. Now, with Wegener's granulomatosis, the key thing with this one is this is associated with disease in the lung and in the kidneys. Okay, very important. It's association with the lungs and the kidneys. So these patients typically will present with hematuria, hemoptysis, and sinusitis because it involves the upper and lower respiratory tract. Now, it's very important clinically to differentiate this disease from what? Goodpasture syndrome. Remember, Goodpasture syndrome also has your hematuria and hemoptysis, but does not have the sinusitis because, remember, Goodpasture syndrome only involves the lower portion of the respiratory tract. So that's a good clinical differentiation, which I've seen like on the shelf exam. Sometimes they put that on the step exam as well. Okay. Now, very important that these patients get necrotizing vasculitis and they get granulomas. So you're going to see acute inflammatory cells, neutrophils with fibrinoid necrosis, and you're going to see the formation of granulomas with giant cells when you see the biopsy. That's very important. Okay. Like I said, it involves the upper and lower respiratory tract and the kidneys. Now, very important too, they can get this pneumonitis as well as these pulmonary infiltrates with involvement of the lungs, okay? Oh, and also I would notice too, with a renal disease, it may be associated with crescentic glomerulonephritis or rapidly progressive glomerulonephritis. I would be aware of that. Now, the key thing you see here, again, is going to be the acute inflammation and the granulomas. So again, you're going to get your fibrinoid necrosis, your neutrophils, and granulomas. However, very important that now C-ANCA is the classic laboratory test with Wegener's. Very important that C-ANCA will be positive, and for treatment, you don't even go to steroids. You go straight to cyclophosphamide. Okay, so very important. You go straight to cyclophosphamide as far as the treatment for Wegener's granulomatosis. Okay, and you see here very good remission if it's treated with cyclophosphamide. Now, however, remember, cyclophosphamide can do what? It also can be associated with causing leukemia and can be associated with bladder cancer, right? So that could be a good correlation. So they can give you a whole history of Wegener's, but the question may be about cyclophosphamide and causing bladder cancer or some other type of disease process. So again, be aware of that. That's how the STEP exam can integrate questions and different disease processes, okay? Now, let's look at the C-ANCA test associated with Wegener's granulomatosis. As you can see here, these are neutrophils under immunofluorescence, and the dark areas that you can see inside the cell, these are actually the lobes of the nuclei of the neutrophils, okay? The portion that are lit up on the outside, these are where you have the anti-nuclear antibodies in the cytoplasm. So that's the orientation you want to make when you look at the cell. Now let's move on to temporal arteritis, sometimes called giant cell arteritis. Now, very important, number one, this is the most common vasculitis, okay? Very important, the most common form of vasculitis that you want to be aware of. Typically seen in elderly females, okay? Very important that it's typically seen in elderly females, okay? And it affects small to medium-sized arteries. And of course, it's called temporal arteritis because it affects the temporal blood vessel, right? And because of that, the patient may present with headaches, okay? It's very important. And they also present with visual problems. Now, like I said, typically it's called temporal arteritis because of involvement of the temporal artery, and giant cell arteritis, obviously why? Because you're going to get giant cells and granulomatous inflammation. So very important, these patients get granulomatous inflammation. Okay, so again, throbbing headache, visual problems are going to be the other thing that they get. Okay, now, very important, if they get temporal arteritis plus flu-like symptoms and joint pain, there's a condition called polymyalgia rheumatica that you may see on the STEP. So once again, polymyalgia rheumatica means the patient has temporal arteritis plus flu-like symptoms and joint pain. Now, very important as far as our lab tests, ESR is one of the things that you typically can see, but like I said, microscopically, you're going to see granulomatous inflammation. That's very important. That microscopically, you see granulomatous inflammation, and that you typically see the giant cells where you have fragmentation of your internal elastic lamina. So very important that giant cells hang around where you have disruption of your internal elastic lamina. So be aware of that. So of course, diagnosis, you can do temporal artery biopsy. So again, you can do angiogram before that to see the stenosis of the blood vessel to determine which portion of the temporal artery you want to take, okay? And very important that treatment is steroids, and patients respond very well to steroid therapy. So it is steroids, and very important, they have a very good response to the steroids. So it's very important to remember for the STEP. Now, very important, we talk about Takayasu arteritis, also called pulseless disease. Now, very important, typical patient is going to be a young Asian female. Typical patient is going to be a young, middle-aged Asian female. Now, very important now, you get involvement of medium to larger sized blood vessels, particularly involving the arch of the aorta. That's the key. Now it's involving the arch of the aorta, and it's called pulseless disease. Why? Because now you have decrease in pulses of the upper extremities because of the involvement of the inflammation. So again, going back to anatomy, we're talking about left subclavian, brachiocephalic being involved. These patients also have headaches though and visual problems, so again they get involvement of the carotids coming off of the arch as well. Okay. Now what you also notice though is this patient also has granulomatous inflammation. So microscopically it looks just like temporal arteritis. They both have granulomatous inflammation, giant cells. So the key is going to be the presentation and or which blood vessels are involved to tell you whether you're talking about giant cell arteritis or Takayasu. So very important, they're morphologically, they look the same. If it's giant cell arteritis, older female, headaches, blurred vision, temporal artery. If it's Takayasu arteritis, again, Asian female, arch of the aorta, decreased pulses of the upper extremities, and the headaches and the visual problems. Okay. And again, loss of pulses of the upper extremities, again, visual problems just like with your giant cell arteritis, and again, steroids is going to be your treatment. Now with your Buerger's disease, very important to see here, also called thromboangiitis obliterans. What does that mean? Well, thrombo just means a thrombus. Angiitis means what? Blood vessel, and then obliterans. So the point is you're just getting a thrombus inside the lumen of a blood vessel and you're obliterating the lumen. That's all it means. So you're going to get the thrombus along with inflammation involving the lumen of the blood vessel. Okay? Now, very important, typically it's going to be a male smoker, right? Typically going to be a male smoker. He's going to present with what? Claudication, which means difficulty in walking or pain during walking. So the point is we're involving what? The blood vessels of the lower extremities, particularly of the legs. That's the key, like the tibial artery, okay? So again, involves the extremities. Classically, like I said, will involve the lower extremities. Thrombosis, obliterating the lumen, is very important. Also making microabscesses. Now, very important, Buerger's disease is different from the other types of vasculitis because not only does it involve the artery, the inflammation will leave the artery and involve the adjoining what? Nerve and the vein. So the entire neurovascular bundle is involved with inflammation. It's the only one that does that, so be aware of that, okay? Also notice how it can be associated with Raynaud's phenomenon, which means what? We're talking about Raynaud's disease secondary to another disease process, okay? So very important, it's association with that. And the fact that treatment is what? You just tell the patient to stop smoking. If it was just that easy, right? Okay. Now, Kawasaki's disease, this is very important because this is the most common acquired disease, heart disease, typically seen in children, okay? Other name for it is called mucocutaneous lymph node syndrome. So these patients are going to have lymphadenopathy, they get a rash, sometimes they get fever. But the key thing is, if it involves the blood vessels, it involves the coronary blood vessels. However, typically it is self-limited, which means they're sick, not doing well for a few weeks or so, then they get better. However, if it is more severe and they get aneurysmal dilatation that's significant, they can get thrombosis of the coronary vessels and can lead to significant coronary disease, okay? So again, like you see here, it can involve the coronary blood vessel. And if it is severe, it can lead to coronary thrombosis or aneurysm, typically causes the mortality of these patients. But like I said, typically the patients have a self-limited course, which means they get better after a few weeks. So be aware of that.